Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today, my social media person, no, I'm just kidding, is making me talk about Jessica Alves. She's very well known previously for being one of the human Ken dolls, because I think there's a few of them. And then in 2020, came out being transgender, and has since then been known as Jessica. She also has allegedly been formally diagnosed with body dysmorphia and is known to, or said to have spent well over $700,000 in plastic surgery. So I thought we would go through some of her transformations and surgeries and talk a little bit about these types of surgeries and what's the benefits and or the risks of these type of surgeries.
And also what's going on with her nose.
And also what's going on with her nose. We're going to talk about what's going on with her nose. Prior to coming out as transgender, Jessica kind of started out looking more like a normal male as far as facial features. She had a rather bulbous nose, which means it had a wide tip and the bridge was a little bit wide as well. And then as far as the facial features, pretty good balance. I mean, she had good cheek balance, strong jaw, chin balance. So overall, just kind of a rather normal, proportional looking face. And then I think continuing into the, her mid-20s at that point, similarly, looked like a pretty much normal appearing male. She was attractive. The facial features were in balance. There wasn't a lot really going on there as far as things looking out of balance. So in her 30s, Jessica had already had multiple rhinoplasties. We're fast forwarding to about her third rhinoplasty here. And the reason is we want to start talking at a point where I think things started becoming a little out of balance. So at this point in her life, you could see, even though it was more of the Ken doll sort of surgeries, it still had a sort of feminine look to the face. The cheeks were way over plumped. The nose was really pinched, so it started to really pinch in and be overdone at that point. And then the lips were becoming very full. Kind of pre-IG face, but these sort of features where the nose is really teeny, the lips are overdone, the cheeks are overdone, the hair is really styled. The thing that I began to notice there again, as things started now to become noticeably out of balance, and so, or looking what I would say unnatural. So one of the reasons we're doing this video was to talk about overly aggressive rhinoplasties, I think. And I think if we're looking now, if we fast forward again, a few more rhinoplasties down the road to her sixth rhinoplasty, you can see at that point Jessica's nose actually developed a hole in it. And what happens there is after multiple rhinoplasties, if they're done with an open approach or too aggressively sometimes, by cutting through these areas, the blood supply to the tip of the nose can become jeopardized. And what happens is the nose doesn't heal, or holes may form, or the nose may collapse. And that's what we're starting to see with Jessica's nose. We're starting to see skin irregularities, maybe skin necrosis. We're seeing collapse of the nose. We're seeing holes forming. And that's why I always advise people not to, first of all, try to avoid multiple surgeries on your nose, but then secondly, not aggressive surgeries on the nose, because then that's when it becomes dangerous and complications like this can occur. More to the same point, in her mid to late 30s, Jessica went under her 11th nose job and admitted that I think it was done in Iran this time, and admitted that the doctor removed way too much cartilage and that her nose completely collapsed. And that's what happens when you remove all the cartilage in the nose, it's going to collapse. And so at least she kind of admits it. I think also looking at the face at this point, it's a little more androgynous at this point. It's kind of probably more in the transitional period. Obviously wearing contacts, different things, playing with different things with hairstyling. And then to me, there are some obvious changes in the face as well, maybe facial implants as well. I think the cheeks are looking really over-exaggerated. It's possible it could just be filler, but I'm thinking there's probably some sort of implants there as well. And then if we're looking at the chin looks really distorted and over-projected. And I'm very suspicious, again, that some sort of chin implant was probably placed in the face. And again, the lips just continue to grow and grow and grow. So instead of going in the other direction and becoming more natural, I see that it's continuing to go in the other direction and become more and more unnatural. And now at this point, the nose becomes extremely difficult to fix, because when it's been completely destroyed or completely all of the cartilage has been removed, it's going to be a very difficult surgery to try and reconstruct it or fix it if she wants. You may have lost track of the number of nose jobs at this point. Jessica's definitely had, a lot of surgeries on her nose, and we talked about the risks of that, collapsing, and infection, and cartilage loss, and seems like she's gone through all of those things. And then at this stage, she's completely transitioned into Jessica, as well as doing the body surgery. She completely transformed her body, breast implants, probably a BBL surgery, liposuction. And I think one of the things to say about her nose at this point is it needed to be completely reconstructed. And that's a very expensive surgery, first of all, complicated surgery, long recovery. But it looks like they did as good as they could get with the reconstruction. It doesn't appear to be simply air cartilage. It looks like there's some sort of nasal implant, could be rib graft, either from cadaver or for my social media person, that's from a dead body. And then, or her own rib, it could be used to reconstruct the nose. So overall, at least now it's not completely collapsed, it's not completely pinched, there is some structure to it. Although again, it appears unnatural, at least she has a nose back. Where she goes from here, it's hard to say. One of the things that I really wanted to say about it is these sort of surgeries, I try to tell everybody, whether transgender, non-transgender, regular surgeries, is don't go to extremes with these surgeries. And that would be my lesson from the surgery personally, is that, try to steer away from these extremes, because you can see some of the complications that can occur with any type of surgery when you pursue the extremes. And one of the reasons I want to bring that up is for the reason a lot of us don't have $700,000 to spend on plastic surgery. And I got a lot of patients that fly off to foreign countries like Iran and Turkey to do these surgeries. They hear a story from a friend, they went and they had a successful experience and they turned out fine, but it is still risky. And then secondly, going to those extremes, it's the complications that get extremely expensive. So not only do you risk having extreme surgery and having results that are unfixable, even if they are fixable, it can be extremely expensive to fix them. And one point I really want to make, when making these videos is that, sometimes these sort of extreme transgender surgeries give good transgender surgeries a bad name. And I don't think that's a good thing. I think that there's a lot of well done, naturally appearing women after transgender surgery that have beautiful results, very happy with their surgeries. And I think in the end here, I hope they get as much attention as these extreme, transgender surgeries, because like I said, again, in the end, they're very beautiful, natural appearing results.
So one of the things that really piqued my interest with Jessica is when you see unedited photos of her, the skin on the tip of
just
her
like
nose.
That Kim thing again.
Was
that one? What was the one you wanted?
Oh, little Kim. Yeah. So when you see unedited photos of her tip looks similar to little Kim's tip, and obviously Jessica has supposedly had 12 surgeries on her nose. But is there anything that she could have done
to avoid that?
Yeah.
Well, yeah, I don't do the surgery. No. Well, I told you, I think the approach, number one, I'm sure they did open. So when you're seeing that skin damage, it's somebody that usually had blood flow problems, and that comes from that opener approach here, because the blood flow is running up to the tip here, and that's how it heals and what you need for healing. And if she had her nostrils cut, and now all of a sudden this could die or the skin could necrose, and that's when you're going to see that skin modeling and kind of the texture changes. Worst case scenario, they had to do some kind of, flaps and things to fix it. It's hard to say, or injections into it to fix it. But the real answer, not to be redundant, is not to go extreme with the surgeries, and then there's, almost zero risk that's going to happen to you.
One other thing I think that's interesting to point out about her is that I know from observing you doing revision rhinoplasties, it's more challenging for you to revise someone else's work because you don't know what was done previously inside the nose. So if you multiply that by 12, probably that becomes very complicated for her.
Yeah, well, every time somebody goes in there, the anatomy is more distorted, or it's been removed, or it's been altered. So when you're going in there, you don't know what, necessarily everything you're getting into. Whether you have the opera reports or things that happened before, it's not always exactly the same, but also in addition to that, scar tissue problems, or if complications occurred after, it completely changed the anatomy or architecture. So it makes it an extremely complicated surgery, and so the risk is multiplying every time that it's a different surgeon and a different surgery, and it just keeps multiplying and multiplying. And that's why I think when you see these patients, even like Michael Jackson, these patients have done multiple rhinoplasty. Eventually, the nose is gonna necrose or collapse or fall apart. So that's why, I A, caution doing that many, but B, those extreme ones, because that's really when they're pushing the limits that you're going to run into those problems and really distorted anatomy and complications, scar tissue, lack of blood flow, lack of healing, and those are not places you want to be with surgery.